internist here in Tucson. I will try to find a few things to add to what these gentlemen have already told you. I'm not here to tell you that the status quo is perfect, or that I have the solution that's going to fix everything and make it perfect. In medicine, we have to be a little more humble, and we have to try to figure out how to make things better rather than worse. One of the most distressing things about the example that our president gave concerning cutting off this person's leg who had a sore in his leg is that, well, gosh, isn't that what he's thinking of doing to our whole medical system? Our Congress is considering the most extreme, radical piece of legislation that probably has ever happened in its history. And it is going to affect your life if it passes. So I want to talk a little bit about what it does, who's for it, and who is concerned about it. It sounds pretty benign, doesn't it? That we're going to have affordable health choices. But what those words really mean to them is not necessarily the thing that you think they mean to you. Now, if you don't believe me, and I'm not saying you should put faith in what I have to say, read the bill for yourself. And this is probably the most intelligent thing that those crowds are shouting at the congressman. Read the bill. Don't believe what the talking heads are telling you about it, because they apparently don't know what's in it either, or else they're lying to you. Now, they're trying to tell you this is a real emergency, and it's been an emergency since the 1940s, or even before then. You might have seen some footage on television of some of the great Democrat heroes of the past, JFK and Truman and FDR, and they tried to get this through, and they failed, and now we're closer to it than we ever have been. Remember, it's really an emergency. Back in the 1950s, when the AMA was against this, instead of being a shill for it, they had a pamphlet for which the title virtually said it all. It said, "The American way is the voluntary way." And all of the academics, serious academics, will admit, although however much they favor the plan, is that the only way you can have a universal plan is to make it compulsory. Because they're winners and losers, and I'll talk to you, mainly losers, and I'll tell you about some of those. Some of the key features that are in the bill, the one that I think is most important, that the pundits really don't seem to be talking about, is what they call the universal mandate. And that is to say, forcing people to buy insurance. Not surprisingly, a lot of the insurance companies like that, because the way to get people to buy their miserable, overpriced product when they don't want to is to get the government to force them to do it. And tell them exactly what kind of insurance they have to buy. And to check on to make sure that they did, through the IRS. Every time you deal with the government, you probably have to prove that you bought this insurance and that your coverage is up to date, and so on. Now, some people say, well, this isn't really so bad, because after all, we have mandatory automobile insurance. But you know, mandatory automobile insurance, doesn't it cost less than $1,000 a year? Medical insurance costs at least 10 times that much. Plus, you don't have to drive. And the reason you have to have automobile insurance is because you've got a dangerous weapon in your hand when you're driving. And the insurance is to protect the people that you might hurt, or of the property that you might damage by driving your car. It's not to protect your car. And by the way, about 15% of people are uninsured motorists despite the requirements, which is about the same number who are uninsured with medical insurance. So medical insurance is different, and mandatory medical insurance is really a very bad thing, particularly since it's not insurance. Now, we just learned about what insurance is supposed to be. But what the plan does, virtually on page number 1, is to outlaw true insurance and force everybody to buy something that shouldn't be called insurance. It should be called a health plan. It's a third-party payment. It turns everything into third-party payment, instead of just the catastrophes that insurance is supposed to cover. Insurance is a voluntary risk-sharing contract, and it's priced according to risk. As you know, if you have a teenage son, or you have a DUI, or you have a fancy BMW to protect, your car insurance will cost more. And it really is kind of like legalized gambling. It's a type of lottery that you hope that you don't win. You pay the premium, and if you lose and have, or the insurance company loses, and you have a bad event coming to you, they have to pay you, just like the casino has to pay you if you hit the jackpot. You have a contractual right to that. But this universal coverage that they're talking about is involuntary, and it's priced according to what they think is your ability to pay. They say it's going to be affordable, but guess who defines what affordable is? And you have to pay for it first. After that, you can worry about your mortgage and your car payment and your car repairs and the shoes that your children need and all that other stuff. Because after all, this is the most important thing to them.
Obama's going to take care of all that.
And the benefits, they won't be written into the contract. I mean, I know insurance contracts are really going to be written, but you can't find out what the benefits are. But the benefits of this plan, they're not even in that 1,000 pages. They're going to be decided by some national health board, modeled on the Federal Reserve, which is, that's such a wonderful job with the American dollar. The New England Journal of Medicine publishes a lot of articles. They're really into this health reform thing, and they're talking about the principles on which this is going to be based. If you don't want to read the New England Journal of Medicine, read Betsy McCoy or Sarah Palin, because they talk about it, Betsy McCoy in more scholarly language and Sarah Palin in more earthy language, but they've got it exactly right. It's going to be just like Medicare, and isn't Medicare really wonderful? But, you know, Bernie Madoff's early investors thought that he was really wonderful too. Now, it doesn't really matter what I believe about Medicare or how much you believe about it and love it ideologically. You need to believe David Walker, who was the former Comptroller General of the United States, who finally quit in frustration. Congress didn't listen to him, so he went around talking to people like you, explaining the little matter of Medicare's unfunded liabilities, which means the number of promises they have made compared with the amount of revenue that they project receiving. Now, how would you like to have your life depend on a bankrupt? Well, that's what you've got. That Medicare has $50 trillion in unfunded liabilities, and I know nobody can understand really what $1 trillion is. But you need to know that $1 trillion is 1,000 billion, and $1 billion is 1,000 million, so $1 trillion is 1 million million. So, when the president says, well, we're going to finance this all by just increasing the tax a little tiny bit on millionaires, to come up with even $1 trillion, he's got to vacuum every cent out of 1 million millionaires to come up even with that. Pretty serious, and we do need to work on fixing it. But at the present time, about 85% of Americans are reasonably well satisfied with what they've got. There are some problems, like some people get their insurance denied because of pre-existing conditions, and there's a cap on lifetime benefits and all that.